Dr. Corinda Hankins.
Hi, I'm Dr. Joanne Smith. We decided to make this podcast for a variety of reasons. One reason is we've had a long history together.
That's right. We've known each other since we were 12. We started going to school together in middle school, and then we went through high school, college, and med school
Med
together.
school.
That's right.
Yes. But I am a pediatrician, or I was a pediatrician in Indiana.
And I've been a pediatrician in the Gorge now for about 20 years. I finally convinced her to move out here and be a pediatrician with me in the Gorge just recently.
So now I work at One Community Health in White Salmon.
And I work at One Community Health in Hood River. And we're both we really love the One Community Health and what its mission is, and that's really about building a healthy community.
Yeah, and Corinna, you've been here for several years in One Community Health, so you kind of really knew how it was, but it's all new to me, right? I've only been here a few weeks, and already I love that actually they practice what they preach. So many times these days, people speak the words, but they don't walk the walk. I don't know if that's even like a metaphor together, but One Community Health really does care about their employees and care about their patients, and it's throughout the community.
And really trying to make the community healthy. And with everything that's been going on lately, I have felt like I really wanted to get some good, accurate information out there. And so I basically just told Joanne that...
This is how kind of things goes in life. Corinna gets an idea, and she just goes gung-ho, and then she's like, come along for the ride.
That's
and I
right.
was like,
and
okay.
I was like, she'll be the perfect person to come and host a pod with me to talk about really healthy kids and how to keep kids healthy in general and all of that. So
Yeah, and we kind of laugh because in pediatrics, we're like the only profession trying to get rid of ourselves, right? If we did our job like perfect, we would never see patients because we'd prevent every illness and every safety problem, everything that would ever go bad, we'd prevent, and we'd be like, we got nothing to do now. So that's our goal.
it is our goal. Our whole life's goal is to really make kids healthy so that they don't have to come see us very often. Peds is the one, I think more so than any other profession in medicine, about preventative care.
Yes.
We're really trying to prevent illnesses, prevent problems before they happen.
And this episode is the one where we talk about ourselves and
Yes.
we talk about our kids healthy.
Yes, and it's really our kids healthy. Like, there's a lot of narrative out there now that kids are sicker than they used to be. They have more chronic problems or chronic disease, and so we really did a deep dive into data, where at the end of all of these podcasts, you'll be able to like link to data that we have in graph form and that type of thing.
In our podcast notes, that's the official term.
In our podcast notes. Okay,
yes.
Sorry.
Learning the terminology,
That's
right?
We're learning all of this. And you'll be able to see that data for yourself in actual links. But we're going to talk about that data here and talk some about anecdotal because...
Right, because we've been pediatricians for 20-some years now. Do not calculate that age. But we have actually seen medicine change in these 20-some years in pediatrics. I mean, huge. Like, our everyday, what we do is completely different than we did 20 years ago because kids just aren't as sick as they were.
That's right. When we were training in medical school and residency, we had completely different training now than they have, or there is completely different training now than there was then. Really, it was kind of impressive that we did so many procedures.
Right. We did spinal taps every day, and
Yeah.
they were terrible, and we hated them, but we had to do them because the kids were really sick.
Yeah, and that's the issue is that like we were with changes that we've made, which we'll kind of talk about more so. We've just found that I just don't do procedures very often. I don't have to send kids to the hospital as often. I don't have to admit kids as often. I don't have to use antibiotics as often.
Right.
Like, all of those things are not just our experience, but we actually, it's data that backs it up too.
And it's across the U.S., but globally too, because of the interventions that the U.S. has made and Western Europe on the whole world's medical needs and problems.
And I will have to say, I mean, it's wonderful that...
Yes, I love not seeing really sick kids anymore.
I know. I mean, it is, I did not go into peds because it was exciting.
It's just fun, is really what it's about.
It really is.
So let's talk about like the things that have come about that have made kids healthier. So, there's all kinds of things, a whole spectrum of things. There is the safety part, right? So Now we use car seats, and we use seat belts, and we use bike helmets, and there's data to show that all of those make a huge difference.
Right. We look at car seats as one of the most fascinating ones because actually the biggest car seat studies came out of where we went to medical school
Yes, a
in
little
Indiana.
shout out to Dr. Marilyn Bowl there for
Yes.
getting the car seat data.
That's
and
right.
changing how Americans use car seats.
That's right. And, one of the biggest causes of death in children and adolescents was truly car accidents. And if you remember when we went traveling,
Oh my
when we were
gosh, the
kids,
station wagon, we'd be in the back, no seatbelts. Every time you turn a corner, you'd fly across the car, and that seemed fun. But now it's terrifying to think about that, right?
Yeah, I mean, my mom kept us in her lap in the front seat when we were babies.
How did you survive to this age, right? We were so lucky because
well, the sad
a lot
thing
of
is
people didn't.
A lot of children didn't survive, right?
Yes.
And so then children developed car seats. They realized how good they were. Studies showed and how great they were for saving children's lives, and they got better and better. We had car seat laws. We had seatbelt laws. All of those actually really came into action, and we saved a lot of lives. So that's one of the preventative, when we really talk about preventative care, that's a large part of what we do in our well child checks.
Healthier, right?
Right,
Yes.
and we talk about car seats. We talk about helmets. Helmets, there's a lot. Actually, Oregon has a helmet law.
Yes.
People should know that, but I still see a lot of people without helmets in Oregon.
Yes.
But
for bicycles, for skiing, for water sports, for hockey and football, all those helmets become a normality. I mean, when we were kids, people didn't wear helmets, and you kind of made fun of the kids. Now it's kind of weird to see a kid without a helmet on a bike, right?
And we're hoping that gets even more, and that's why we talk about it.
Right, and it saves not only kids' lives, but also their brains, which kids' brains are just more vulnerable because they're still changing and they're still kind of plastic, and any damage that happens to them as a kid is hard to get past.
So, one of the things we mentioned is that we'll have links, and one of the biggest links we have is that childhood mortality has decreased significantly over the past 50 years, and really even more so over the last 25. So we have a really distinct drop in childhood mortality, and so most children will make it to adulthood now.
Right.
And that is a wonderful, wonderful thing, and we like to take credit for that in pediatrics.
Exactly. So we're making all the differences. So safety is part of it. I mean, the basic things of hygiene, right? We know a lot more about hygiene now, pasteurization of milk and keeping food safe, right? Refrigeration. All these things seem like just part of our world, but they were huge steps to help our kids be healthy, right? Decrease the mortality.
And really reduce the mortality and morbidity of all the problems that came along with those things. But then the last one, and we're going to talk a lot about this in this podcast and future podcasts, are vaccines.
Right.
Because vaccines have really changed our world. And they've changed the lives of children. And, one of the other links that we talk about is there was a recent article in Lancet, and it was from data with the World Health Organization, that they estimate about 154 million lives have been saved over the last 50 years, mostly by vaccines. And interestingly, the vaccine that has saved the most lives out of any, and this is going to be our next podcast, is the measles vaccine.
Right, so we'll touch on that later. But let's talk about the narrative why people are saying kids are not as healthy as they were, when we know that that's truly not the case. Why is that happening?
Well, I wanted to say a little bit more, because I do think that one of the reasons that we've seen so much less from a standpoint of illness, hospitalizations, all of that, is that we don't see as much vaccine preventable disease. Right. And it's not just measles vaccine.
Right.
It's
the
pneumococcal.
Right. That was a huge one early in our careers, where every day you were sending someone to the hospital for like a rule out sepsis, which is when babies get a fever and we don't know why they have the fever. You have to make sure it's not something
in their
really
blood,
serious. Right.
And it's fluid around their brain.
And that would just happen every day. And now that just does not happen hardly at all.
No. I probably send, one child to the hospital maybe a month now for a further workup. And I see some pretty sick kids. I mean, and I still, who have chronic diseases, because some of the only pediatricians in the gorge. So we see a lot of kids.
Yeah.
And we see some children with really chronic diseases. And I don't send kids to the hospital. I don't admit kids like I used to.
Yeah.
I don't have to do urines. I don't have to do lab work. I don't have to do a lot of the things that were just part of our job.
Right. Yes. And I mean, RSV, right? RSV used to be the major reason we admitted kids. And
it is still the most common reason a kid gets admitted.
But this winter, maybe it's starting to change,
that's
right?
right.
And
exactly.
that's what, there's been a vaccine for RSV out for 20-some years. It was just used on premature babies. Not even a vaccine.
It's an antibody.
Yes, it's an
Right.
antibody. And it made a huge difference in those kids that were high risk, the premature babies, kids with chronic lung disease, kids with chronic heart disease. And then after those kids stopped getting as sick with RSV, we started to see the normal newborn, the term infant, the young infants without the chronic disease start to get sick with RSV. So last winter, winter before last, they came out with a new antibody that could be administered to all babies up to 8 months of age. And there was a little supply issue the winter of 23-24, but this winter, I mean, the rate of RSV was so much less, and the rate of hospitalization was so much less. So I'll be interested to see that data
as it comes out after this year.
After this winter.
Well, and it's not just an antibody that we can give to children. We can give it to pregnant moms, and that actually protects the child because there is some immunity that does cross from mother to child, and most of that wanes in the first 6 months. But having that vaccine, the RSV vaccine for moms, if they have it right about 4 weeks prior to birth, they actually can see that it'll last through that first season.
Safe, very safe with very few side effects, and we really see it make a difference for how sick kids get with RSV.
Right. And we'll talk more about how vaccines work, when we have the best immunity, why we give them the way they do in a future podcast. But what we wanted to get at here was just that's a big reason why we just don't see the sick kids we used to see.
Yes.
Kids are definitely more healthy, across the board.
So why is there that narrative saying that kids are not as healthy? What is that coming from, do you think?
Yeah, I mean, I think it's from several different reasons. I think one of it is this thought of obesity, right?
Yes.
Obesity everybody's like, obesity's an epidemic and all kids are obese. And that's just not true.
No. Yes, the percentage of obese kids varies per state and per region, for sure. But it has been really consistent for about 20 years, right? The percent of obese kids has been about the same, and how obese they are has been about the same. Not the same for adults, that has changed, but we're only talking about pediatrics because that's kind of what we like to talk about. So
it's really all we like.
In terms of medicine, right? Yes. So the obesity rate hasn't really changed.
No,
but a lot of it is the way our society works now. Is there's just more information sharing, whether it's true or not. There's just more information sharing. We're not having to communicate by telephone.
Right. That's true. And we know how that went.
Yeah, exactly. The telephone game never works well.
No, it never works well. But I kind of feel we're still in this telephone game. It's just now with social media, unfortunately.
Yes. And then mental health, right? That has been a big topic, especially since the pandemic. But the rate of suicide, it's been the same since the 80s?
Yeah, it did come down again. We saw an increase again during the pandemic, but it actually didn't go down very much, and it truly is the same as it was in the 80s.
Which is not a thing we're doing great with. Suicide prevention is something we always need to keep work on. But again, that is a community outreach. We could focus on the support from around the child, not just...
And I will say it's a lot, too, about, what we talked about, diagnoses. And there is, and this is what a lot of people don't know, is that years ago when we first started out, if you got a diagnosis as a child, like say you got a diagnosis of asthma or
a
chronic disease of some kind, they actually could take you off health plans.
So or refuse to give you insurance.
Refuse to give you, your parents, your family insurance. And that was a big deal. So a lot of times we actually diagnosed with more of the symptoms versus the
Right,
true
call it reactive airway disease or
wheezing versus saying you have asthma, even though asthma is what you had.
Right.
We didn't necessarily call it that because we wanted to make sure that everybody was covered. And and then changes that were made where pre-existing conditions no longer like caused a drop off of insurance. We were allowed to finally like not only diagnose things, but actually say how well they could be treated. And
and our asthma rate may have gone up in terms of like more kids are diagnosed with it now, but our rate of hospitalization with asthma has like
decreased
so much because we have good medicines now that help prevent with very few side effects.
Yeah, I very rarely have to admit an asthmatic where I did it all the time.
Oh my gosh, every 4-hour treatments have to go back and listen to them. I have to go back to listen to them. That was like daily.
Well,
in
you
med
even remember in med school we didn't even have like real albuterol or things. We used theophylline. Do you remember how horrible that was? Oh my God, that was awful. But anyway,
it's kind of like caffeine but worse.
Worse, way worse.
And kids on that, you've seen your kids on caffeine, like kids on theophylline. Woo!
It was awful. And it didn't work.
No, and it didn't work great.
Right? Like, that's the problem, is that, and so not only were kids hospitalized more, but they died more from asthma. And we do not see that anymore.
Yeah.
Like, I very rarely admit for asthma now, and I luckily have not had
good
any
immunotherapy, because allergies being part of asthma too. And some of the rate of asthma increasing is also air quality. Right, and that's our air quality is not improving. We're not helping with that prevention very much. And like we're talking about, the air quality here really is affected by forest fires. In Indiana, it's affected by the fact that most of the power is still coal and oil, and so air quality there is kind of always bad. Here, it kind of just depends on
weather.
Yeah, more than anything else.
I mean, I think that's true. And I mean, if you look at the data, again, we have actually a really good link to the worlddata.org, and that's one of the links you can find. And they have these amazing data charts from all over the world. But one of the things that you find was what we talked about: decreased mortality, increase in vaccination rates. All of those are in there, but also pollution. Right. And pollution has gone up, a ton. Like, so it's a direct one. Right. One of the other things that I find fascinating, though, is that we talked a little bit about mental health. And I think one of the big mental health things is also that we talk about it now.
Right.
We are not scared to diagnose it. Like, kids always had depression and anxiety. Mm-hmm. Again, the suicide rate's the same.
Right.
So they always had depression and anxiety. Now we talk about it and we try to help with it. And we still don't have the best treatments for it.
No.
Like, we're still searching
it's
for
a
the best
treatment, right? If a family is suffering, the kids are going to suffer too. So if parents are battling depression, anxiety, their kids are part of that. And so we need to help the whole family. That's why One Community Health is so great.
That's
helps
right.
the whole family.
But I also think that I know that this is because there's some really good data that show that when children are exposed to things like social media and gaming and a lot of
screen time
in general, you have a direct link. Like, it goes up after an hour and a half of screen time, no matter what that be. Rates of anxiety, and anxiety, depression, and suicidal ideation all increase at the same rate with how much TV or screen time or whatever you're watching.
Yeah, and we're in a society where that's just part of our life, right? But the important part with kids is you need to talk to them about it, right? Make them take breaks, talk to them what they're watching, and watch it with them so that it's not just isolation time on the screen. It's let's share this information together, let's be entertained together.
And let's talk, some screen time is worse than others.
Right, exactly.
There's a lot on social media that kids really shouldn't be being exposed to. And that is a parent-driven thing, right? Parents have to be part of that conversation and willing to have hard conversations with their children. Right. And I think that's one of the things that kind of developed really fast and in a way that parents actually lagged behind, right? Kids were so much better at it.
Oh, these
parents
toddlers
were kind
that
of
can
horrible.
Negotiate anything without even being able to read. I'm like, oh my gosh, right.
And they're, I mean, truthfully, adolescents are way better at that stuff than adults are. And so I think that's part of where it just got out of hand. And part of it is our parental responsibility to really learn enough to have those hard conversations before our kids start onto social media. And then after they start onto social media saying, you know what, this just isn't healthy. And
Right.
we're all going to stop it, like together, again, as a family, as a community. I think that's a really, really important thing. But I do think that that's one of the things that has caused that spike in, like, our children less healthy.
Right.
And yes, we have more of those diagnoses. I don't think the diagnoses are that much more considering the situation we're in. And again, I think a large part of it is because we just didn't diagnose them well before.
Right. We just didn't talk about it.
We didn't. We didn't talk about anxiety or depression at all when we were kids. I
No.
mean, we grew up in the 80s. And those 80s movies really do have some things like
We did
we
live
did
in an
not
80s.
talk about stuff.
No, we did live in an 80s movie for sure.
Yeah, that's right. Our kids talk about a lot how we lived. They felt like we lived in an 80s movie. So, but yeah, that's part of it. And then I think the last one we talked about was autism.
Right. And the diagnosis of autism has increased, but again, because we are talking about it more, we're not mislabeling it. We're acknowledging that there are all kinds of brains, and sometimes as kids, we need to help them to develop to the point where they can socially interact with others without feeling too stressed. And sometimes that's speech delay, sometimes that's social delay, but just the diagnosis of autism did not really happen much before the 2000s.
We were saying, like, and it was all like, diagnosis and their criteria kind of have lots of different ways about it, but we followed, typically it was a psychiatric diagnosis and DSM criteria, and that changed like right as we were finishing medical school and in the residency. And before that, to get a diagnosis of autism, you had to have like very specific characteristics, and everything else fell into this like pervasive developmental disorder. Like it just fell into this weird, like significant developmental disorder that we kind of just said they're delayed. And as we got better at diagnosis, that the real criteria fanned out, and we were able to really understand what an autism spectrum diagnosis was. So a lot of it is diagnosis, and then a lot of it is that we're finding more and more that there's genetic links to it, age.
That it's not necessarily one condition. It's a variety of conditions. That's why it's a spectrum, right?
It is a spectrum.
And we just are talking about it more at an earlier age because we're more aware of the signs and symptoms, so we can get more intervention earlier.
Yeah, and so that, again, our focus is as a community and really as pediatricians is that kids can have healthy, happy lives.
Right.
And what we found is that when we intervene early and really give them the help they need, that is exactly what they can have.
Absolutely.
So I think that's really a large part of the narrative that's come along. And, hopefully we've kind of helped understand some of that about why there's a lot of data just to show. And again, we linked that children are healthy and they are healthier than they've ever been.
And we are so thankful for that. We're just eliminating our job. It's
that's
great. So awesome.
And again, we would love to come in and just be able to like do well visits all day and talk about preventative care and never see a sick kid. That would be our ideal because that's exactly what we love about pediatrics is that children are these amazing, wonderful beings, and we want every single one of them to be able to grow up happy and healthy. So with that.
So here are some practical takeaways.
Yes.
So we do know that kids are healthier and live longer than they used to. Vaccinating your children and following some pretty simple guidelines on preventive care are the key. And since we've talked enough.
We forgot something.
What?
Sorry, my computer kind of died and I couldn't see it. But it's really to talk about, we use less antibiotics.
Oh my gosh, yes. We used to prescribe them all the time, every day, and now way less often.
Yeah, we do. I mean, like I used to prescribe them for like ear infections all the time, pneumonias, urinary tract infections, like all the time. We were seeing those in children a lot, and really, again, with the initiation of vaccines, like the major things that caused ear infections, like and a lot of pneumonias, like pneumococcal, we don't see anymore.
We don't. And there was some really scary stuff. Remember we first started out like epiglottitis, which is an inflammation of the back of your throat, and now we have the vaccine against H flu. We don't see it, but it was terrifying. You really walked in a room and you're like, I cannot make this kid mad, because if they start screaming, they might stop breathing.
Right. I mean, it was actually, that was one of the most terrifying experiences in my residency.
And we don't see it anymore, because it really has decreased, and we don't have to use antibiotics for it because it's not even happening.
No, not at all. I mean, we still use antibiotics. We still have strep.
Right.
You know, and you had that really great like talk about strep, but
what I was talking about is that prior to the pandemic, they actually had done some research to show that people who get recurrent strep throats, because anyone can get strep throats and kids are more prone to it because they're all in each other's faces than adults, but there are some people, especially in some families, that just keep getting strep throat again and again and again, and what they realized was those people had an immune deficiency that was very specific, that they didn't make memory cells for strep, and so they could actually start working on a vaccine for those families who kept getting recurrent strep. But then the pandemic happened, and the vaccine people got kind of busy. So that is a thing we know, and that's evidence-based medicine, right? That we know there's actually something real why some people get strep and other people don't.
Right. I mean, I think the other important thing to remember is that like strep in a lot of people actually isn't that dangerous. Like a lot of adults actually clear strep on their own, or they basically carry it without a lot of problems. For children, it is different. Strep and the complications from strep can be significant and much more severe than in adults, from arthritis to heart conditions. It's just really, we need to treat strep if it's there, and so we still do antibiotics.
Right, because there are some terrible abscesses that came back last fall when we had strep really bad.
Right, that was awful.
But you know, the nice thing is too is we actually have better preventive care for strep, because we can test for it now. We can do a rapid antigen test in the office and know. Whereas at the beginning of our career, that's not what happened.
No,
at the 80s,
we
you
did
couldn't
a
be
culture.
doing it. Right, we did a culture that would take like 3 days to come by, and you have to plate it yourself. Did you have to plate it yourself?
Yes,
right, and put it in the little agar plate and put it in the fridge and all that stuff. And now we just in the office, one drop, and we get the answer.
Yeah, which is really nice. We do have a lot of things like that for RSV and influenza. We have a lot more ways to test things now, which are fast and simple and very easy.
And not just guessing.
No,
right?
Not guessing.
That's kind of how medicine's changed since we started. We were in this unique position where all of a sudden we went from just kind of guessing this is the way we do it to being like,
I call it the art of medicine.
The art of medicine was lovely, but the science of medicine actually saves lives. So let's just go with that for now, right? And that's one reason I could move here from Indiana and start practicing here is because we're doing medicine the same way across the U.S. because we're all doing it based on evidence.
Right.
Which is amazing.
And so much of our evidence-based medicine has changed. I mean, when you and I went to medical school and residency, we were just starting to see like this whole peer review of articles come out, right?
Right.
It's one of the reasons why like there was some misinformation in the 80s and 90s is that like some of those first things just weren't well designed. The studies weren't well designed. They weren't peer reviewed well. Information got out that wasn't actually accurate. And really over the last 25 years, we've done such a great job of really focusing and changing our medicine to evidence-based medicine.
And we're not bloodletting as much.
No.
Unless you have like hemosiderosis or something like that.
That's right.
But they still use leeches, right? My friend who's a wound care physical therapist.
I'm kind of grateful that I've never used a leech.
Yeah, it's not as fun. But we have a lot more things now that we're just not making it up as we go.
No,
we're really like,
right.
you know what? This is what actually helps you.
Yes.
Let's do it.
And we're teaching our residents that, and then that allows us to really make good decisions. And you know, those decisions are what we really feel like keep kids healthy. So.
Okay. So if you want to hear more from us, please subscribe to our podcast and feel free to put questions in.
I think we might not answer them like right away.
We will someday.
We do have jobs, and that takes up most of our time. Although my husband says that I have a volunteer job as well as just a regular job. But But it is, we are thinking maybe one time we'll do a podcast with that. We'll
Answering
just
the
take all your
questions.
questions
Absolutely.
and answer them.
And and there are definitely different themes we're going to do along the way. That if you have questions about other things besides are kids healthy, put them in there, and that might give us ideas for topics for the future.
Yeah, exactly. And then we will our plan is that we will do a different topic along with at least 1 to 2 different topics with every podcast that drops. So one of them will usually be about a vaccine, and then the other one is going to be about something in pediatric medicine, like maybe sleep.
The one with sleep.
That's the one
I want to do next.
So
okay,
that's it for us, and thank you for listening.